As it is the new year, many people will create the classic New Year's resolution of getting healthy. Many people will look to both the ideal male physique and the ideal female physique set by this nation as a guideline to meet. Now, to reach these goals, many people will create a rigorous workout and diet routine. Now, as we know, along with the stereotype, many people will not follow through with this, but to some people it will become something much more. It becomes an addiction.
Good afternoon. My name is Jose Badia.
I'm King Lin.
And my name is Matthew Nichols. Now, first, we have to identify what addiction actually is. The fact or condition of being addicted to a particular substance, thing, or activity is what addiction is. Now, many people will identify this with a drug problem or an addiction to food, but it doesn't necessarily have to be a substance. It can be an activity. So our question is, to what extent does exercise addiction affect athletes and people suffering from mental disorders such as anorexia, bulimia, and body dysmorphia, and how these sufferers can be helped? And our final solution was, through knowledge and identification of the addiction, steps can be taken to assist with the removal of the addiction. Now first we have to identify what exercise is. Exercise is the physical exertion of the body, elevating the heart rate, and creating a calorie burn. Now, this is performed by many people. It's used to enhance physical fitness and your overall health, and it's great to perform. Athletes do tend to take exercise to a new level of extreme. It can be very challenging, and it's not always necessarily enjoyed. Now, exercise addiction is the unhealthy obsession with physical fitness and exercise. There are many traits commonly seen with exercise addiction and normal addiction, such as participating in the addiction in secret, participating through injury, and participating when a participant no longer wants to participate. Now, one of our main problems is only 0.3 to 0.5% of the populations are sufferers, according to Heather Hosborough, a professor at Jacksonville University. Now, while this may seem like a small percentage compared to the US population, this is still thousands upon thousands of people. Now, why this matters? Exercise addiction is highly unheard of and is connected with multiple mental disorders and conditions that can create detrimental effects. As seen, a sufferer with anorexia or bulimia can use exercise to enhance the weight loss process. Or a sufferer of body dysmorphia, also known as muscle dysmorphia or bigorexia, can use exercise to enhance their physical fitness, which can cause raised blood pressure and cardiac problems. Now, a healthy habit can quickly turn unhealthy. Many people support this addiction without knowing it, as it is seen as a healthy habit. And the effects can be rapid weight loss and gain, social isolation, obsession over the disorder, and as previously mentioned, cardiac and blood pressure problems.
Now, when it comes to exercise addiction, there will be many thoughts that will develop inside the mind. These include having a desire towards superiority and appearances like wanting to lose weight, you are fat, or ugly. Now, these negative and anxious thoughts will lead to an increase of stress, and having a high amount of stress will lead to detrimental effects such as depression, anxiety, and social isolation. Now, as you see here, this is the red token that's being enclosed by that glass dome to show that isolation effect. Now, in social isolation, the person is dealing with situations on their own, which means that they're distancing themselves away from friends and family. Now, this in turn actually increases stress even more because you don't have the support, the assuring support from people you know, and they can't help you with anything at all. So, so is there any way that for them to combat these problems alone? Why, yes. What's the answer? Dopamine. Now, dopamine is a naturally formed chemical that is in the brain, and it sends signals to the body to create that happy, euphoric pleasure system. Now, Now, the effects that produce are similar to marijuana, meaning that it can be abused very easily. And regarding in exercise addiction, since the addicted have high stress levels and low amounts of dopamine, this means that they will constantly exercise to the point where they're at that happy state. So to just get that certain part of the body just perfect and superior, but in turn it's not. So to summarize, basically when the addicted have these weird appearance thoughts like being ugly or you want to be superior, they just exercise to get get that certain body part to the perfect state. And as a result, they think that they're in a happy state and they have it fixed. However, they realize that there's that one other part that's not perfect. So they gotta exercise again and again until they get that happy state, and so on and so on. Now, with this mental breakdown, we can confirm that we can confirm that the mental status of people under exercise addiction can be treated with therapy. So as you see in this picture, this person is laying down on a chair and being counseled by a professional therapist. Now the therapist will be able to know how the behaviors, the goals, and other thoughts that are developing inside the patient's mind. And with this, the patient is allowed to understand what exactly they need to limit, such as exercise. And speak of exercise, exercise addiction does have a physical effect. Jose?
As mentioned before, exercise addiction does not only affect one mentally, but physically as well. This addiction can develop certain disorders and conditions that can be very dangerous and potentially life-threatening. Now, conditions and disorders like anorexia nervosa, bulimia nervosa, and body dysmorphia can all be caused by this terrible addiction. Anorexia nervosa is an eating disorder in which a person is obsessed with his or her own weight. The person will take extreme measures to lower their body weight. These measures may be misusing laxatives, starving, and or exercising excessively. Bulimia nervosa is fairly similar to anorexia nervosa. When one suffers from bulimia, one may binge. This means eating high amounts of food uncontrollably, and then purge, which means getting rid of this food consumed in an unhealthy manner. Now, these manners may be self-induced vomiting, as seen in this picture, exercising compulsively, and misusing laxatives. Now, these two disorders are fairly identical, basically. Sufferers will usually take the exact measures to lower their body weight. Now, body dysmorphia is a condition that can develop with exercise addiction. As seen in this picture, this woman may be skinny, but in the mirror she sees something completely different. Sufferers from body dysmorphia will always find something wrong with their body and will always try to criticize their own body. Now, this is very dangerous because they will do whatever it takes to change how they look.
Give it up for him. Let's go.
Now, people who suffer from exercise addiction exercise at high amounts. This can be very dangerous. Your body needs rest, your muscles need rest, they need time to recover. If rest is not provided, the risk of injury is very high. It can cause body fatigueness, and as seen in this picture, a really ugly injury. Now, with proper identification of these conditions, disorders, and symptoms of exercise addiction, the future could be bright, and future cures and treatments could be found. Once again, as mentioned, only 0.3 to 0.5% of the population suffers from this disorder, which really it doesn't, doctors and scientists don't really recognize it. But with proper identification, steps can be taken to find a hopeful treatment or cure. Thank you. More questions you have?
All three of these. Perfect. All right, thank you guys. Let's see. How do we pick these questions? Okay, start over here with you, Ken. Describe how the content of the team presentation changed as a result of your group discussions.
Well, unfortunately, we had a team member just leave our team, so it was pretty complicated for just the three of us to figure out like what exactly to put in. So that team member had the futuristic lens. So what we did was we tried our best to integrate that lens into our presentation, and it worked out.
Okay, thank you. Jose, what was the strongest counter argument to the solution or conclusion that you guys identified?
Well, the strongest counter-argument was that this addiction is not really recognized. Again, as mentioned in the presentation, only 0.3 to 0.5% of the population suffers from it. This may be a low percentage, but it's still thousands and thousands of Americans. So really, right now, it's not, the addiction itself is not really recognized, and this can limit the steps taken to find a treatment or cure.
Okay. And Matt, Describe an argument from one of your peers' individual reports that makes you think differently about your solution.
Well, the whole idea with addiction is most people see it as a form of substance. So with Kang's idea of psychology and the connection to dopamine, we were able to create the connection of a chemical substance being the idea behind the addiction. Now, with this, we were able to use this as the driving force as our entire presentation, and I did make a couple changes to both my slides and my presentation, or my slides and my paper, to include this idea.
Thank you. You guys are done. Breathe.